when we say dementia, I think people are more, used to the word Alzheimer's. They are one of the same. Dementia is mainly a cluster of symptoms, whereas Alzheimer's is a disease that happens in dementia. So, what happens in dementia? People generally forget, and that's how we all know that okay, dementia is the disease of forgetting. But it is not only forgetfulness, it is the complete disease of the brain where the brain shrinks or there are deformities in the brain. Dementia also impacts the daily life. So the person is not able to do their own basic activities of daily living, like eating, taking care of themselves, going to shower, or somebody has to constantly keep them telling that what they are supposed to do. When they get up in the morning, they're supposed to have breakfast. So they are completely dependent on something. Every time, I get a lot of people who say that, I'm forgetting, I think I have got dementia. Or people would say that I got so confused, I think I have developed dementia. It is not like that. Dementia has to be clinically diagnosed. First, we need to understand that there are multiple things that can also have a pseudo dementia kind of a state. So there are a lot of things that happen that can lead a person to behave like a dementia symptom, but it is not. So as you all know that I'm going to talk about dementia and Alzheimer's. September is the global World Alzheimer's Month, where globally all the dementia organizations and Alzheimer's NGOs try to reach out to general public as much as possible so that people are aware that what is dementia, it is a disease, and what to do about it. So I'm quickly going to take you through the understanding of dementia. So when we say dementia, I think people are more, used to the word Alzheimer's. They are one of the same. Dementia is mainly a cluster of symptoms, whereas Alzheimer's is a disease that happens in dementia. So what happens in dementia? People generally forget, and that's how we all know that okay, dementia is the disease of forgetting. But it is not only forgetfulness, it is the complete disease of the brain where the brain shrinks or there are deformities in the brain. So, dementia is not like a psychological problem, it is a psychopathological problem where the brain has clearly pathology in as people age or because of different diseases, or it can be multiple issues why there is some sort of a change in the brain which causes dementia. It covers a range of physical diseases. It is very progressive in nature. So that means that dementia will keep on increasing as time goes by. Eventually, it is terminal. Unfortunately, there is no cure for dementia. There is no medicine that will cure the disease. But there are a lot of medicines that will take care of symptomatic things that happen in dementia. Why are we talking so much about dementia, and why you will see now and then you will hear about it? The reason is that people are not much aware that it is a disease, how to take care of it, yet there is a huge number of people living with dementia in India. In Hyderabad, there was a survey which was done by NIMS Hospital in 2013. And that time they quoted that there are about 40,000 plus people. By now, this number has doubled up. So I can easily say that there are more than about 1 lakh people living with dementia in Hyderabad alone. Now, the thing is that where are they? Why are they not coming to hospitals? So let's try to understand. Now, what happens in dementia? As I said, that there are brain changes, there are nerve cells that are damaged, and the connections are lost. Memory loss is one common thing that we hear about dementia. Then, other than that, there is thinking problem, there is cognitive issues, judgment making problems. Then comes the behavioral changes, where there are a lot of psychological issues, where there are, which are called BPSD, behavior and psychological symptoms in dementia. Dementia also impacts the daily life. So the person is not able to do their own basic activities of daily living, like eating, taking care of themselves, going to shower, or somebody has to constantly keep them telling that what they are supposed to do. When they get up in the morning, they're supposed to have breakfast. So they are completely dependent on somebody. And as I said, progressive decline is there. That means it is a neurodegenerative disease where the symptoms worsen over time and it leads to the dependency on other people. Eventually, it is terminal. So, when we talk about our brain, that dementia affects the brain, you see that this is a healthy brain, and brain has multiple functions. Everything that we do is a command of the brain. So the thinking, planning, organization, memories, short-term memories, long-term memory, autobiographical memories, everything related to our life, our background, our culture, everything is stored over here. Everything that we do, like just sitting over here, talking to people, understanding which button to click, what, everything the brain commands. And when the brain gets impacted in dementia, all these things are impaired. And that's how we see that there's a major change in people who get dementia. So at this point, I'm seeing so many doctors, so many teachers, people who used to work in farming, they have got dementia. Like they were some personalities, existing personalities, and suddenly in the last 5 6 years they have come to a point where they don't even understand that where they are, they don't know what date it is, there is no orientation. So that is a major change that happens in dementia. Basically what happens is like our brain is not able to give the correct message, the direction of message, that the way it travels, our signaling system, it gets impacted. So when we give, say, an instruction to the person with dementia, they don't understand what I am speaking, what I'm trying to instruct, or or how they are supposed to behave or react to that. So types of dementia. As I said, Alzheimer's is a very common thing that we all must have heard at some point. After that comes vascular dementia, which is caused mainly due to stroke, post stroke, or there are other types of dementia like Lewy Body, frontotemporal dementias. So, dementia is basically an umbrella term described to a range of symptoms associated with cognitive impairment. And under that symptom or under that umbrella that you can see, then comes Alzheimer's, vascular, Lewy Body, or frontotemporal. Dementia is very complex disorder. As I said, it is related to brain, and brain itself is very complex. But as somebody gets dementia, it just makes things so complicated because the person understanding is not there. There is a dependency. And every time when we talk about dementia, it is not only the one person who is impacted, it is the entire family unit which is impacted. So let's see, every time, I get a lot of people who say that, I'm forgetting, I think I have got dementia. Or people would say that I got so confused, I think I have developed dementia. It is not like that. Dementia has to be clinically diagnosed. First, we need to understand that there are multiple things that can also have a pseudo dementia kind of a state. So there are a lot of things that happen that can lead a person to behave like a dementia symptom, but it is not. So dementia can be reversible cause and irreversible cause. Reversible causes, as they are listed over here, like, say if somebody is taking a psychiatric medicine, somebody is like having depression, or there's some sort of a very acute viral infection or other infection, or certain medication, brain tumors, or metabolic disorders, vitamin deficiencies, these can have some impact on our memory or judgment, and where it can show like dementia like behavior, where there is a memory loss, confusion, disorientation. But when these things are treated, they will get cured. So this is reversible causes. This is something like we need to understand that it is not that every time I forget I've got dementia. Every time there are multiple reasons why somebody can have a memory loss, or it can be a fall, it can be a head trauma injury, something like that. But in dementia, which is irreversible cause, it is clear that the brain will have some sort of a pathology. There can be like a shrinkage, or there can be clots or something. So that is something that can't be reversed. So that is Alzheimer's, FTD, or vascular dementia, post-stroke dementia. Those are irreversible, that we can't reverse. Whereas the reversible cause that are listed over here may be multiple reasons. And that's the reason why we need to go to a doctor to understand that what exactly is happening. So certain causes, yeah, this is exactly what I was talking about. So Alzheimer's, vascular dementia, Lewy body from frontotemporal, dementia caused because of Parkinson disease or Huntington diseases. These are irreversible, whereas the other ones are reversible. So one thing about our community, and I absolutely understand that, a lot of time we neglect our health. Our healthcare trajectory is very different. We'll be like, it's just a little bit of symptom. I think I will overcome it. And like that, weeks pass, months pass, and we just delay going to the doctor. But at this point, I'll take the liberty to like remind you that if you feel something is amiss with your own body, with your own self, you need to reach out to at least to the family physician and discuss. Not necessary that you end up to a specialist or a very extreme this thing. You at least need to reach out to the basic doctor to understand that, okay, is there something that I need to be concerned about, or is there something? So when we talk about, see, these reversible things, it can be because of the hypothyroid or diabetes or abuse of alcohol. So they will give us the right channel to understand that where we should be going, rather than we taking a decision that, okay, I really need to go and see an expert at this point. So this is something that we all need to understand, that there are certain reversible causes and irreversible causes. Now, in when we say that, as I said, like a lot of people will say that, oh, I have just got dementia, I'm forgetting so much, I'm so confused. But there is a significant difference between the normal forgetfulness, like you and me will have, and a forgetfulness of AD. AD means Alzheimer's disease or dementia. So, in a normal forgetfulness, say, I went somewhere, I went to Bombay and I completely forgot about it, like which flight did I took, which day it was. But then when I try to retrace my steps or retrace the whole thing, I am able to recall. If nothing, I will go to probably my phone app and see that when did I go, which ticket did I book. So I know how to. A normal brain knows how to retrace to recall. Whereas in a dementia scenario, they might completely forget the experience. They might be like, they might have spent like 5 years in Bombay or something, and they're like, no, I've never been to Bombay. Or they might, end up saying something that they have never been to. They might just say, just to cover up the situation. So, one thing is that when we talk about dementia, like, yes, the brain is impacted. There's a lot of the domains of the brain, right? The understanding, judgment, orientation, everything is impacted. But at the same time, the self, the individual, the insight is very strong in dementia person, where they do have an understanding that I am forgetting. They, at to some extent, like maybe in the early stages to the moderate stage, they do understand that, oh, there is something I answered wrong. So they will try to cover up. Whereas in our this thing, we know that, oh, I'm lying. I don't need to, if I can't recall something, I might just not cover up like that. So in normal forgetfulness, sometimes, say I'm so excited, you probably bought a new phone. So you will keep on telling your friends that, hey, I got a new phone, I got a new car. So we repeat our stories in excitement, or to distant friends or to families. They'll be like, hey, I went there, I went to Europe and something. So that is our excitement. There is a reason why we are repeating it so much. In dementia, there will be repeats of question and stories, or something like, they might just keep on asking, what is the time? What time is it? Where am I? Even if you say that, yes, this is like, right now it's 11 o'clock, it just doesn't register to them. And that is the short term memory that happens. And that's the difference between a normal person and a dementia person, where they will keep on asking the question even if you have given the right answer to them. Or they will keep on asking, what's your name? Where did you come from? What's your name? So even if you like answer it, you after 5 minutes, again, they are going to ask the same question. And the thing is, as I said, that they do have the insight, they do understand how I am behaving or you are behaving. So, when we get irritated with those repetitive questions, there's a high chance that they will also get aggressive about it. So, then in normal forgetfulness, like we know how to read, write, the language part. If there is something written, or we know that, what are the proverbs or something like that. Whereas in dementia, as the brain gets impacted, they forget the language. So, for instance, like, generally in our community, we all are multilingual people, like, English, Hindi, Telugu, so many language. But there will be a primary language, my mother tongue, right? So what happens in dementia? First, they will start forgetting the secondary language that the brain has picked up when, like, when maybe in school or in work areas. But the secondary language they will start forgetting first. So when even though they've been talking, say the secondary language, it could be English or Hindi for all throughout their life, suddenly they're not able to understand that. So it is not exactly. And one thing you need to understand that each and every dementia person individual is very different. So we can't compare that, oh, this is the same thing, or you can't be comparing that, oh, this is what Sadia said, so this is how it has to be. No, each person, each individual is so different. Each type of dementia is so different that it will keep on varying. So these are like some common things to understand, not like, just to copy paste and see that, oh, this is what happened. So just to try to make you understand, right? Then dementia risk factors. Now, this is something that I really wanted to emphasize in this talk, are risk factors and preventive measures. So you go to any doctor, I think they're going to say that, okay, you need to have a healthy lifestyle, good sleep, a better lifestyle which has like good health eating habits. That's exactly the same thing every disease would probably ask for. So even in dementia, the risk factors, the causes that can impact how somebody will have dementia are listed over here. So, which are like limited education. When we say limited education, it doesn't mean that, illiterate people will have more of dementia. It is not like that. Limited education, when it is said over here, means that those people use less of the cognitive domains. They do not like if you have to see the examples of it, a literate person will probably read newspaper, they will have like something, maybe working in office, so that adds to the cognitive well-being in comparison to the person who is illiterate. But in an illiterate, if you have to take an example, maybe that illiterate is doing other cognitive activities. It could be like farming, gardening, or some other skills. So that balances out. But limited education is one of the risk factors. Hearing loss or loss of smell, that is again a risk factor in dementia for somebody to get dementia. Hypertension, high cholesterol, I think this is something we all need to work on. Obesity, extra weight, use of alcohol, smoking, head injuries, especially people who are using bikes or use helmets. It is something like a very small thing. Every time you will hear everybody saying that use helmets. Trust me, like it is one of the cause. Like I have seen people who fell or had accidents in their 20s and 30s, and by after 20 years or 25 years, they have developed very random dementia. And it's very difficult for the science also to prove it that what happened. But with you thin line to the point that, oh, there was an accident and he was not wearing a helmet or she was not wearing a helmet. So it does impact, even a small impact to our brain, because brain is a very complex thing, very delicate thing. It's very difficult to say that what will happen after years, after say a fall or trauma. So it is not necessary every time it happens, but then yeah, when we know it, why not to be preventive? Then depression or psychiatric illnesses or social isolation, our lifestyle has become so much like that. We have a lot of friends on phone, right? We have on Facebook, on WhatsApp, but in person, we do not meet people. And that is the social integration, which is very much needed for a well being of any human. then physical inactivity. I think earlier, if we see like our grandparents, even till our parents, they had so much walk. Today, when I come to office, I'm just getting dropped door to door by a car or a cab, and then there's hardly any physical activity for me unless I take out that physical activity time. I go for a walk or something else. So that is the inactivity that we have absorbed in our lifestyles. I'm sure a lot of people will agree over here that, compared to the older generation, our grandparents had so much of better life or knowledge. Then our parents had lesser than that, and we are definitely much lesser. So imagine that our generation, the next generation, what is happening to them? There is a very high level of inactivity, physical inactivity. So now they are glued to phones. There is actually a study which was published very recently, which said that this generation, the younger generation, is having high risk of dementia or cognitive impairment in late age because of the inactivity in their childhood. So we need to be very careful of how we are spending our time right now. So one thing, dementia doesn't happen like in a go. It is not like one particular day the brain will start showing any pathological impairment. Dementia actually starts like 15, 20 years before it starts showing any symptom. So say some person is in 60s and is showing dementia symptoms, there's a high possibility that the atrophy or whatever the change is happening in the brain actually started 10, 15, 20 years back. So if you have to think about it, like people who are in their 30s and 40s, what you're doing right now is going to reflect after 20 years. Okay. The same way, people who are in their 50s and 60s, what you are doing now or what you have done before is going to reflect. But you have not lost time. People in 50s and 60s and even in 70s still can, pick up better lifestyle and work on it. And that will definitely help as preventive measures. So these are certain warning signs to watch out that somebody is having some sort of a cognitive impairment. Memory loss, as it's a very common thing that we know that, okay, dementia will start with memory loss, but it will also start with difficulty performing familiar tasks. Like, say, there's a housewife who has been cooking throughout her life, and suddenly she's not able to make like a small rice or tea, not able to perform small tasks that they were familiar for years. Same way, like a man who used to go for grocery and suddenly he's not able to calculate the money, he's not able to get the grocery back. So sometimes we're like, we see these symptoms, but then we neglect it because we are not aware. And that's the reason why we try to promote so much that, okay, the more you know, the earlier you understand dementia or there are some warning signs in a particular person, there is a better treatment chance. When we say treatment, it is more like a care management. Now, the other warning signs are disorientation to time or place, not getting confused, where I am, what time is it day, night, then impaired judgment, not able to make small decisions, crossing the road, or just like, is the water hot, or the food has salt or not. So those small judgments are lost. Problem with abstract thinking, misplacing things, changing mood and behavior, and then change in personality, like somebody who has been very calm, very aloof, or very, say, a very calm personality, and suddenly getting very irritated, or suddenly trying to shout at people, very verbally abusive or something. So these are the signs that we need to be very careful of. Then there is loss of initiative, which means that a person just doesn't feel like doing anything. So they'll get up in the morning and they have no plan for the whole day. So they'll, unless somebody says, get up, brush yourself, have breakfast, so somebody has to keep on probing. So you have to start observing that are there some changes in the people around you who you observe or who you live with. And one more sign to be aware is like challenge is understanding in visual and spatial information, which is more like, they're getting confused with colors or 2D or 3D effects. So these are certain signs to watch out for. If you observe these signs, what to do? You basically, first, as I said, that reach out to a doctor for a consultation. Go to a doctor, discuss that what is happening. Then, the doctor if it's like just a physician, maybe they will recommend you for other doctors. So if there are these warning signs that you have observed, so for dementia, or you can reach out to a memory clinic, or you can just reach out to a neurologist or a psychiatrist or a general physician, your family physician. They will do cognitive assessments, like to understand what is happening in the brain. They might ask for certain blood tests, scans, and then the diagnosis happens. So this is exactly how it should be. And we, after the diagnosis, it's a complete new journey that starts for the person with dementia and for the family itself. So there is no cure for dementia. Then why are we talking so much about the treatment? Yes, there are certain medicines that will help to slow down the progression of it, or there are some symptomatic medicines for behavioral issues. So you have to be in the loop of your doctor. And dementia is something that you need to understand that it is like not impacting one person, it is impacting the entire family. At the same time, the care that you need is from a doctor and from, say, a dementia expert who's a psychologist, or a non pharma intervention. So now on the screen, if you see, there is a medical treatment. So you have to go to your doctor for that. But there is non medical treatments also, that is care management, because dementia is something that every now and then there are new types of symptoms, challenges, issues, and those can be handled with care, or which can be managed with understanding, not necessary with the medical treatment. So there are a lot of things like, say, as there is a repetition, they'll keep on asking same thing again and again. You can't go to the doctor and say that, there is a repetition, I'm getting irritated, they are getting irritated. There's no medicine for it. So there is care management. There are other ways. That's what we call it, non-pharma interventions, non-medical treatment for it. How to manage these challenging symptoms, what to do when there are these symptoms which doesn't have any medical solution. So there are other therapies like cognitive stimulation therapies, which is something brain exercise. Or there are other services like a daycare for dementia where people can spend the whole day, get stimulated, be busy throughout the day. Or there are other places like residential care where they can stay for good. Then, in the last column that you see, that is for the caregiver. Now, the caregiver is a very important person in the whole thing, whole journey of dementia, where they are managing the person with dementia, they are managing everything. So, there is a lot of ask for the caregiver itself. We will keep on, we will counsel the caregiver more than we counsel the person with dementia. So the family needs a lot of counseling, training on dementia, and it's literally the new journey that starts from. So I just wanted to give you an example of a dementia journey. So there is this Mrs. Chirit, which is a very anonymous name. Then she had dementia. She lives with her daughter, and there is a granddaughter, and she needs help. So she's in a very severe state. So every day she needs help for dressing, eating, washing, going to the bathroom. She's having difficulty swallowing things. So, which is also in a very severe stage of dementia. It is part of it where they are not able to swallow well. So, when we say that the brain is getting impacted, so far I think what I have said is like more cognitive things. But as time passes, like as the disease progresses in the moderate to severe stages, the body also starts forgetting the functions. So it is like, there will be difficulty in swallowing, the muscles will slow down. So it takes them a lot of time to understand how to sit on a chair, or what is the purpose of a chair, right? Then, taking this example, this lady, like she had memory decline, there was a high dependency on caregivers. So that means the daughter and the granddaughter has to continuously care for her. They have to cut down their own activities like going to work, going to college, meeting friends for the sake of their loved one with dementia, so that they are around, and it needs a supervision. It is not the best of the example, but then the brain actually becomes like a 5 year old or less than that. So they need a constant supervision. They don't understand what are the risks, what are the hazards. They might just put on the gas and just forget about it and walk out. So it is very difficult, it is very challenging, and the family caregiver has to continuously support the person with dementia. right? Then there is the isolation and limited mobility. So even for the caregiver, there is a social isolation. They're not able to go to friends, to family functions. They're not able to bring the patient to the family functions. So there are so many things that gets impacted. So the caregiver will be emotionally, physically, financially impacted due to the dementia. These are certain different stages of dementia where you can see in early stage memory problem, difficulty in thinking, language, communication, poor time orientation, mood changes. So in the very early stages, you will see that set of symptoms. But as it reaches to the middle stage, it becomes very difficult where, the family is having a lot of issues like continuously looking after the patient. It can be, and see, one thing is that Alzheimer, for example, Alzheimer's has a general lifespan of 10 to 12 years. So imagine like a person living with this kind of a disease for 12 years. Like one lady I knew, she lived for 16 years with Alzheimer's. That is something a very challenging thing to understand also because the family continued, her spouse, who was also in the late 70s, continuously supported her and the issues that he had. And then, financial burden because of, the medication or because of the attenders that they had to get. So in the middle stage, which can be the longest stage also, it will have more of challenging issues, behavior issues, physical dependency. Then there is a need of attender, a paid care, and then not necessarily all the families will be able to afford that kind of a thing. So that's why we say that there is so much of emotional burden and financial burden. Late stage, it is a profound memory loss where they may not even recall that who is the immediate family. They may not recognize their own children, their grandchildren. There's an impaired communication. They are just not able to communicate. They want to eat something, they don't want to eat something, they're not able to say anything. Then there is an inability to recognize the surrounding, the house they are in. Is it, as I said, is it day, night? What time is it? Swallowing difficulties are there. Loss of recognition of familiar people. See, it is a very challenging thing when, say, a patient with dementia is not able to identify or recognize the caregiver, the daughter, the son, or the immediate family. It is a absolute, it shatters the person completely that what am I doing it? Why? I mean, who am I caring when they are not even able to recognize me? Right. And then eventually, after the late stage, it is the end of life where people can be like completely bedridden. There are so many challenges that happens in dementia. So, why am I emphasizing it so much on dementia? Why has it become like a cause for dementia? In India, there are more than 8 million people living with dementia. And as I said, that it is not only that person, it is the 8.8 million families who are impacted with dementia, with all the issues that we've been discussing about emotional burden, financial burden, physical burden, and unfortunately, because there is not much awareness of dementia, only 10% of this number ever gets any diagnosis, any treatment, or care. So think about the families who are not getting any attention at all or any diagnosis also. I have had so many families coming to me after their patient has died and like, I think now it sounds that it was probably dementia. I wish we knew about it. We would have taken care better. What happens is when there is not much knowledge, when there is no diagnosis, people just try to manage within their house with whatever knowledge they have, whatever resources they have. And it can be a mismanagement also. There can be abuse also. There can be so many negative aspects that happen. And the families who, like the person will eventually die one day, but the person with dementia will die one day, right? But then the families who are the, say, the younger generation or the spouses, they live in guilt. I have so many people coming after, like, after that loved one has passed, like it's been 5 years, 10 years, because there's so much in guilt and so much in remorse that I wish I knew how better to manage. I wish I did not shout at them. I wish I could, there's so many things. And that's one reason we need to understand that dementia is not just for the elderly who is cognitively impaired. It is the entire family unit which is impacted financially, emotionally, and it is not like it is ending with the patient. It is being carried on. The burden is carried on for years and years. So, one thing about our country and our community is that family predominantly provides long term care for people with dementia, which means that at home we are taking care. So, in the developed countries or in the Western world, they have dementia priority, like government priority, dementia as the health priority. So, they have a lot of schemes and a lot of policies for dementia. So, a lot of places, say in US and UK, it is the government who supports the dementia care. So they will have residential care, they will have day cares, they will have like nurses coming at home. We don't have anything like that. So complete cost, the burden comes on the family. It is so even if the family wants to put them in a daycare or in a residential care, it is the family who has to bear the cost, and we don't have that kind of services in our country. So in the box that you see on the left side, right, so for the 8.8 million people, we don't even have more than, I mean, I know I have written it less than 1,000 daycare or full-time care, but I know the actual number and it is much much less than 500 also altogether. So we don't have services. We need, there is a huge need and demand, but then for some reason we still have to evolve in dementia care. So you can imagine 8.8 million people, when we say it is more than like population of countries. There was a study that was, there was a report actually that was done in 2010. So that means 15 years back, where they said that out of pocket expenditure for families for a dementia person was 45,000 that time. And of course, it's been 15 years, it has doubled up. So on an average, a family is spending around 75,000 to 1 lakh rupees per month for dementia care. We are talking about middle income families, upper middle income families. What about the families who can't afford? That's a completely different discussion. I think we have not even gone there to discuss. And it's a complete different challenge that they are facing. So dementia is complex because it is brain, but at the same time, socially also, it is very complex for families. At the same time, there is so much stigma attached to it, where people are like, because of poor awareness, people don't know that it is a disease. They will still talk about stigma, idioms, and in every language. So I had published a research article where we were able to list out the how each culture or a different part of India, how people pursue dementia. Like I remember in the North India, somebody gave an example that there was a dementia patient in a village, and because he was like soiling his clothes, there was so much incontinence, was not able to understand where to go for toilet and all. So he used to just soil his clothes and wander around, which is also a symptom of dementia. Kids used to throw stones at him. So imagine like an elderly in 70s having so much issues, and because there is so much stigma, the family is also like they don't want to get involved with it. They're like, okay, whatever. I have Unfortunately, I've had families asking me directly, just tell me that when is this person going to die? Because that's the only solution for them. So we have so many challenges, so many things that comes with dementia. So it is not just a disease, it is a social issue. There are so many things that comes with dementia. Now, how can we prevent dementia, right? So there are, yeah. So there was a study that happened, a Lancet publication, which said that 40% of these cases could be preventing by addressing these lifestyle modification. Actually, if you think about it, it is nothing much. It is just the lifestyle factors that we need to change in our daily routine that will help to prevent the dementia, our dementia, my dementia. So you can, exercise regularly, pick up physical activity that will keep you healthy, keep a track on. So you have to, basically increase your cognitive well-being, education, the more you read or the more you use your brain, physical activity, social contact, in-person contacts, adopt a healthy diet, eat well, Sleep well. That is something very important. Sleep is directly associated with dementia. So get sufficient and quality sleep. Take time to de-stress yourself. That is something very important in today's life. I can just say for everyone, let it be any age group. We all are so stressed, which is causing hypertension, diabetes. So we need to control all these things. The more that we work on these aspects, it will help to prevent the dementia. Dementia can also be genetic, but that is something that we can't help. But if we try to adopt a lifestyle, a better lifestyle, it can help us all to reduce 40% of chances to prevent dementia. So I think this is absolutely doable, and we all need to work on it. Let it be like somebody in their 20s, 30s, 40s, 50s, 60s, whatever. I know so many people in their 60s and 70s, for the first time, they have ran marathon or they have picked up cycling, long distance cycling. So it is all in our head that, oh, I'm 60 and I can't do anything. Oh, I'm 70 and I should not, this is not my age of doing it. No, it is not like that. It is more in your head. It is more culturally that we think. If you want, you can just, pick up a physical activity, learn a new skill. Learning a new skill is basically that will help as a cognitive reserve. Now, so I want to talk about this cognitive reserve in dementia. It is nothing but a very simple concept. Cognitive reserve is basically brain's adaptive capacity to compensate for age-related or pathology change. Basically, when we are physically active, when we have a cognitive well-being throughout our life, that will help for the old age prevention of cognitive decline built through enriched neural networks, flexible cognitive strategies. So, when we talk about cognitive reserve, it's something very simple. Like the more activities that you have done in your younger life, in your 30s, 40s, 50s, even in 60s and 70s. So, it is like cognitive reserve is like the brain, the more you use your brain, it's going to be healthy. So, education, lifelong learning. When we say lifelong learning, pick up new skills. Say, learn a new language, learn a new skill like maybe swimming or maybe crochet, something that you have never done so far. Why? Because that is something that is the part of the brain that you have not used so far in your life. So, when you are learning the new skills, it will help in a cognitive well being. That will help your brain stay healthy. Mentally stimulating occupations. There are so many nowadays. We all are bound to a laptop, and it's a desk work. But there are a lot of occupations which are cognitively stimulating. Even a desk job is cognitively stimulating, but something like people with hand skills or people who are like constructing things or building things, that also works as a cognitive stimulation. Social engagement and community participation, hobbies and art, music, storytelling. All these things helps as cognitive well-being and cognitive reserve. And eventually it will help in the prevention of dementia. All our spiritual practices, our prayers, bhajan, kavali, yoga, meditation, everything that you do will impact for the cognitive well-being of your brain. How the cognitive reserves in the protective role? It will delay the onset of clinical symptoms. It enhances the resilience against memory loss and functional decline. So, for example, somebody who has a very good cognitive well being or a cognitive reserve, who has used the brain very well, healthily throughout the life, when they develop dementia, also, it supports in a, if ever they develop dementia, I should say, that also helps in the dementia cognitive stimulation compared to the person who has absolutely no cognitive reserve, who never had any hobbies. So, the at the center where we do a lot of cognitive stimulation, brain exercises, it gets very difficult for us to work with people who never had any hobbies or who never knew any other skills other than whatever their work was. So it also works in protective role in our culture. There are so many Indian specific opportunities, intergenerational living. We have like, even though nowadays we all are nuclear families, but still our communication, the way we meet for maybe cultural things or for the frequency of meeting, right? That also matters a lot. Our family dynamics, then craft, gardening, storytelling, traditions, these are very low cost sustainable things. See, these are the things what we are trying to promote, that you try to increase doing your hobbies and cultural things and religious things, that will eventually help to prevent dementia, that will eventually help for your well-being. Okay. Yeah. So in dementia, there are these certain these are psychological symptoms that happen. I just want you to have a small brief understanding of it, that dementia can impact neuropsychologically, even with a lot of psychiatric issues also. So there are wandering, perseverance, aggression, lack of inhibition, hiding things, sundowning. So these are some common things that happen in dementia. And generally, why it happens is like it's an unmet need. To understand it, it is basically that when the person is not able to communicate, say they want to have a glass of water and they're not able to say it because the communication language has been impacted because of dementia. Of course, they're going to get irritated. Imagine like you want to say something and you're not able to say it. So how irritated you can be. There can be anxiety that I want something and nobody's understanding. So there's generally an unmet need what causes all these symptoms. There can be pain or discomfort, or it can be grievance, frightening, or a strange environment. So every time, parents are made to change the environment. If it is somebody with dementia, they will definitely have a lot of confusion and disorientation because they are used to that old house. That doesn't mean that we change, but there is a way that if they are put into a new environment, how to make the environment modification adaptable for dementia. Okay. Just a quick thing to understand that, every time we say that in dementia, there is the functionality is declined. So they're not able to do the basic things and they need that self care. Somebody has to help them with it. So this is what happens in dementia, impact of the quality of life. The person is impacted. They have their own set of symptoms and issues. At the same time, the caregivers, the family is completely physically exhausted, emotionally stressed, financial strain, and the complete, as I said, that it takes them years and years to come out of that burden that they have gone through in the dementia journey. And it is not only the one caregiver in the family that is impacted, it is the entire family unit. So even if the, say the siblings are staying out, but the other sibling is taking care of the parent or somebody, it is the entire family unit, the dynamics changes. So it just makes things so difficult, and the entire quality of life of the entire family unit is impacted. So, non pharma interventions, right? A treatment which doesn't require medicines. Yes, there are medicines required in dementia. At the same time, there are a lot of non medical management that happens in dementia. So, interventions that does not involve medicines. There's the aim to support the cognition, the cognitive well being that I've been talking about, right? Behavior, functionality, quality of life. There are a lot of therapies, environment changes, caregiver support, and meaningful activities that will help the person with dementia. It helps to slow down the progression. It helps in positive emotions, foster verbal communication. Even if they're not able to communicate, still they are able to communicate through the activities or the other therapies. Maintain abilities and independence. That's something very important for a person, and especially in dementia person, to improve their self-confidence, helps manage challenging behavior, improve quality of life. Eventually, when we talk about dementia, it is the quality of life that impacts or that is matters. So these are some therapies that we do under the non-pharma interventions. There are cognitive and emotional oriented interventions. Then there are brain exercises. There are multiple other therapies that we use for dementia person. And this is nothing like a rocket science. This is something we try to convey to the family caregiver also, that they adapt it. See, they are the best person who understand the dementia person, their personality, what they will like, they will dislike, and based on that, then they can have, and these are something very simple. It's not that you have to sit the whole day and do it. Just 10 minutes every day, some of these therapies can be done and really have a good impact on the person with dementia. So when we talk about non-pharma therapies, you can see there is reminiscence therapy, going through the old memories, happy memories, pet therapy, music therapy, art therapy, speech therapy, physiotherapy. All of these will have positive impact on the person with dementia and something very easy to do at home. Cognitive stimulation, the brain exercises, as you can see, they help as equivalent to a medicine will help the person with dementia. So just a quick this thing that who are we? Like, Alzheimer's and related disorders, Society of India, Hyderabad Deccan chapter. We've been working for the cause of dementia for the last 17 years in Hyderabad, and we've been providing multiple services. So we initially started because there was nothing for dementia care in Hyderabad, and in 2008, some caregivers, their families and their parents were impacted with dementia. They came together, and that's how they started. And so the organization got built up on non-pharma interventions. So we work more on cognitive stimulation, a very holistic, collaborative approach, and that is what is needed for dementia. Mm. We also work a lot with caregivers for support groups and workshops, right? So these are some numbers that we have reached so far. And our services, so we run a memory clinic, we run a daycare center, which is called Alambana, where we do a lot of cognitive stimulation therapy. We also have caregiver support meetings every month, where we try to reach out to the caregivers so that we can, help them to understand better what is dementia, the symptoms, or any burnout that they are having. Then we try to do home visits for certain for people with dementia to help them in environment modification. We also run a helpline and a WhatsApp group where it is available for the caregivers where they can, just ask any question that they would like to understand about dementia care, not mainly for the medicines, but non-pharma challenges that they face or the services that they want to understand that. So we initially started in COVID, and now we have about more than 200 families on this group across the India. This group has spread, and it is a live group. So there are a lot of experts from our end who are there. There are some doctors also available on this WhatsApp group to support the caregivers. Then other services that we provide is awareness drives, like how we are doing right now with WishwaTalk. And then there are training and internships. There's research that we try to publish from our organization. We have recently started doing free clinics and community outreach where we go to these underprivileged areas and we try to conduct free memory clinic for poor people. And then we are in advocacy, and we've been doing a lot of free public memory screening camps where we try to just understand, like, like how you do health camps. So the same way we are doing memory screening camps so that more and more people understand that what is happening and what is dementia.